Hi, Dr. Jed. Hello there, David. Today I'll show you a tour around antibiotics. Sounds cool? Cool. Now, what is an antibiotic? Well, an antibiotic is a drug that kills or inhibits the growth of bacteria. But please keep in mind that not all bacteria are bad. Some are useful, for example, those bacteria to maintain your gut health. However, some bacteria can cause illnesses and even deaths. And this is where antibiotics are sometimes, if not oftenly, used to treat illnesses caused by bacteria. Are antibiotics found over the counter? The answer to that is no. Most, if not almost all, antibiotics are not found over the counter. I would need to see your doctor's prescription before dispensing or giving you antibiotics. But even though antibiotics are not found over the counter, I still think it is important to teach you a bit about antibiotics, given how commonly it is prescribed and used. Alright, now you said something about antibiotics killing or inhibiting the growth of bacteria. Why do you say killing or inhibiting instead of just one of them? Do different antibiotics sort of work differently? You're absolutely right about antibiotics having different mechanisms of action, which is basically how a drug works to do its purpose. Generally, we can classify antibiotics into two when talking about this general mechanism of action: bacteriostatic and bactericidal antibiotics. Well, what's the difference between bacteriostatic and bactericidal antibiotics? Bacteriostatic antibiotics prevent and inhibit the growth of specific new bacteria, depending on what bacteria species an antibiotic has activity against. Bactericidal antibiotics, on the other hand, kills bacteria, again depending on what bacteria species that antibiotic has activity against. So now, what are the common types of antibiotics that are being prescribed to people? Well, I'll just give you a few examples here: amoxicillin, doxycycline, azithromycin, cefalexin, and cefixime. If you wish, I can teach you in brief a little about these drugs. Sure, I would love to learn about these drugs. Perhaps we could start talking about amoxicillin first. Now that's fine with me. Amoxicillin is part of the penicillin family of drugs, and it is a semi-synthetic penicillin. So, is amoxicillin bacteriostatic or bactericidal? Amoxicillin is bactericidal, which means it kills bacteria it has activity against. Very, very good. Talking about what disease amoxicillin treats. When taken orally, it can treat acute bacterial sinusitis, which is the inflammation of the sinuses due to bacterial infections, ear infections, throat infections, nasal infections, urinary tract infections, gonorrhea, upper respiratory tract infections, enteric infections, and intra-abdominal infections caused by the bacteria Salmonella. Now that all these infections must be caused by a bacterial pathogen. Now, I once got prescribed amoxicillin, and the packaging said amoxicillin and clavulanic acid. Why is clavulanic acid added to amoxicillin? To understand that, we have to talk about antibiotic resistance. This happens where some bacteria mutates and evolves or releases enzymes which make antibiotics less effective to treat bacterial diseases. Thus, these bacteria become resistant to these antibiotics. Amoxicillin's resistance is due to its inactivation due to penicillinase. Penicillinase is an enzyme that degrades penicillin, such as amoxicillin, by the hydrolysis of the cyclic amide bond found in the beta-lactam ring. Penicillinase is part of the beta-lactamase family. Penicillinase is part of the beta-lactamase family. Clavulanic acid, usually in the form of potassium clavulanate, is a beta-lactamase inhibitor of beta-lactamases produced by some gram-negative bacteria, such as Neisseria gonorrhoeae, Staphylococcus aureus, and Enterobacteriaceae. By inhibiting beta-lactamases like penicillinase, clavulanic acid thus enhances the activity of amoxicillin against a wider range of bacteria. Clavulanic acid also allows amoxicillin to be more active towards more types of bacteria, even against some resistant strains. So now, how does amoxicillin work? So amoxicillin binds to penicillin-binding proteins, which block the final transpeptidation step of peptidoglycan synthesis in the cell wall of the bacteria it has activity against. As a bactericidal antibiotic, it kills the bacteria it has activity against. So, what are some side effects of amoxicillin? Some side effects people can experience with amoxicillin after they take it include diarrhea, indigestion, headache, and nausea. Because of this, it is encouraged or recommended by your doctors to take amoxicillin after finishing a meal, such as lunch or dinner. Now, what about its precaution? Who should this drug not be given to, or be given very cautiously by medical practitioners. While those who are hypersensitive or almost like allergic to amoxicillin, those with cholestatic jaundice, and those with impairments of the liver function due to amoxicillin should not take it. Alright, now let's move to another antibiotic. Let's talk about doxycycline, should we? Sure, no problem. Alright then. Doxycycline is commonly found in the form of doxycycline hydrochloride. Its antibacterial activity and mechanism of action is similar to that of tetracyclines. They are mostly bacteriostatic in nature and is a broad-spectrum antibiotic, which means that it can treat a large variety of bacterial diseases. By the way, what is a bacteriostatic antibiotic? A bacteriostatic antibiotic is an antibiotic that inhibits or prevents the growth or production of bacteria the antibiotic has activity against. Just testing you, very good, well said. Thanks for a lot for the compliment. Now, what diseases do doxycycline help treat? Well, as doxycycline is a broad-spectrum antibiotic, the list of diseases it helps treat is a very long list. I'll just give a few examples then. So, it can treat spotted fevers, traveler's diarrhea, urinary tract infections, and respiratory tract infections. Now, respiratory tract infections can also be caused by viruses, but keep in mind that antibiotics are only for bacterial infections. So when I say respiratory tract infections, remember that they are bacteria-related respiratory infections such as bacterial pneumonia. Now, how does doxycycline generally work? To use a more fancy name, what is its mechanism of action? Well, as I said earlier, they are mostly bacteriostatic. They interfere with the protein synthesis of bacterial cell walls by reversibly binding to the 30S ribosomal subunit, which prevents amino acid transfer RNA from binding to the mRNA ribosome complex. Cool. When taking doxycycline orally, there are no requirements stating that it should be eaten before meals or after meals. However, you should take it with a full glass of water and sit or stand upright for at least half an hour. If you experience gastrointestinal discomfort or like stomach pains, it is a better idea to take it with food to reduce such side effects. What kind of side effects could you feel after taking doxycycline? To name a few, the ulceration of the esophagus and gastrointestinal disturbances such as vomiting are some of the side effects. Now, who should take doxycycline with precaution? Those who are hypersensitive or produce allergy-like reactions to doxycycline as well as other tetracyclines, children below 8 years old, except for the case of anthrax, pregnant and breastfeeding women should avoid it. As common with other drugs, dosages for severe renal or severe hepatic, which is the liver, impairment should be altered or used precautiously. Are you done talking about doxycycline? Yes. How about now we move on to talking about azithromycin? It's a common antibiotic. Sounds like a good idea. I've kind of heard it before. Azithromycin is a macrolide antibiotic. It is classified under the family of macrolide antibiotics. Now, I know you're going to ask about what diseases it treats. Like, what diseases does it treat? I knew you'd ask that next. Now, when you give azithromycin through the mouth, it treats respiratory tract infections, pharyngitis, which is the inflammation of the pharynx caused by bacteria, sinusitis caused by bacteria, otitis media, which is a type of middle ear infection caused by bacteria, as well as some bacterial genital infections, just to name a few. I took azithromycin orally. Do I need to take it with food? Well, you can choose to take it with or without food, but if you have any like stomach pain or stomach discomfort, then it's a better idea that you take it with food. Okay then, now how does azithromycin work? What are its side effects? Any precautions, or to use a fancy word, contraindications? Azithromycin is a bactericidal antibiotic and binds to the 50S ribosomal subunit, which prevents peptide chains from translocating. This in turn inhibits bacterial synthesis. Talking about its side effects, azithromycin can sometimes cause mild gastrointestinal discomfort in some people, as well as headaches and sleepiness. Overdosage symptoms include diarrhea and severe nausea, which can also lead to severe vomiting. Those who are hypersensitive to azithromycin should not take azithromycin, and caution should be practiced on those with impaired kidney or liver function. So that's the end of my small lecture to you. Thank you very much. No, it really shouldn't be me. It should be me thanking you. Thank you so much. You've taught a lot. Bye-bye.